Welcome back. If I sent you here, it's because we're talking non-specific chronic low back pain. So if I've sent you here, I hope you've watched the first 4 videos, the introductory, what our foundation is, how we do our foundation, and how we advance our foundation. If you haven't, you need to go back there, and then you can come back here all week. Okay. Now, anyways, getting back to it. So that we've talked about all of those things. Now we're going to talk a little bit about chronic non-specific low back pain. So like I said in a prior video, 80 to 90% experience it at some point in their life. 70 to 80% deal with it on a long-term basis. Chronic non-specific chronic low back pain can stem from a multitude of things. So what this means is you don't have slip discs, you don't have bulging discs, you haven't torn a muscle, you don't have some crazy injury, there's no doctor's diagnosis. This just hurts and you don't know why. You've stretched it, you've tried to strengthen it, you've tried to work out. Sometimes it's debilitating. You don't know what to do anymore. It just hurts and you don't want it to hurt anymore. So we've talked about our foundation. If you haven't watched that, go watch it because I'm just going to keep moving forward. All right. So our foundation's in the front, but when we have to think about other things like an anterior pelvic tilt, if you notice, this goes forward. Your pelvis is forward. What that does is it shortens your QL, which runs right here, quadratus lumbar. That then also pulls on your SI joint. Your SI joint then also pulls on your psoas or your piriformis. Your piriformis can influence your psoas. And since you're in this tilted position, your psoas, which goes like this, is pulling everything nice, tight, and forward. So all of these muscles are in situations they should not be in. The muscle activation isn't right. Some are strengthened, some are lengthened, some are excessively shortened. And it's not fun. And it hurts because this should not be like this. This is a nice long muscle that is there to protect your spine. This connects to your tailbone. This connects all of these things. This, if you've ever noticed, if you push right here across your butt and that's sore, that's your piriformis, okay? That sucks when it's tight. Your psoas sucks, and the psoas release, if you actually are releasing it, is painful. It sucks. Now, with all of those things, we may also notice if we sit at a desk job, right? We're sitting like this all day. Our hamstrings become weak and they become shortened. Our quads become shortened and weak. Everything's getting short and weak or lengthened and not how it's supposed to properly be used. That's going to be your basis in your foundation. That's where a lot of non-specific chronic low back pain starts. It starts with improper breathing. It starts with ribs coming up. It starts with shoulders going forward. It starts with your pelvis flipping. It's very basic things in our posture that lead to long-term outcomes. They can also be hard to correct. They can require consistency. They require proper training, and they require a lot of the interior musculature to be addressed. We can't sit here and do 100 crunches and Russian twists and planks and address our transverse abdominis, our internal obliques, our diaphragm, releasing our QL. Those are all things that have to specifically be targeted, mentally addressed. That mind, muscle, body connection has to be reestablished, and then we have to move forward. So I hope that answers some of the questions on the basic literature of non-specific chronic low back pain, why we're programming the way that we do, and how we're going to address it and fix it. If it doesn't, or if you have questions, shoot me a message, leave a comment, let me know.